Hi, everyone. My name is Dupe Akinrimisi, and I work for the Health Equity Zone as a family planning educator. And I'm so excited for today's events. We're here today to discuss the different ways to start a family. Our experts are here to answer all your questions regarding fertility and conceiving. Not sure where to start? Learn today about where to begin, options available to you, and the best ways to ensure a healthy beginning. Thundermist provides primary care and prenatal care. Our providers are here with us today to answer your questions. Let me introduce you to Dr. Jennifer Buckley and Dr. Shamila Panjwani.
Hey everyone, thank you, Dupe. So I'm Jen Buckley. I'm a family medicine and prenatal care doctor at Thundermist and do deliveries at Kent Hospital in Warwick. I hope this Q&A is helpful for people who are trying to expand their family. There's so many things to think about during this exciting time, and you came to the right place to begin that journey.
Thank you, Dupe. Hi, everyone. I'm Shamila Panjwani. I'm a family medicine resident at Thundermist. I work with Dr. Buckley and do deliveries with her at Kent Hospital as well. We are so excited you're here, and we want all of our patients to know that Thundermist is here to help. We offer so many programs and resources for all stages of pregnancy, and I'm looking forward to answering all your questions, Dr. Buckley, today.
Thank you both. And before we begin our Q&A, Thundermist would like to recognize Neighborhood Health Plan of Rhode Island, United Health Plan, and Landmark Medical Center for generously sponsoring this virtual series. Thank you for making this virtual series possible. We're excited to have one of our baby shower sponsors with us today. Lori from United Healthcare Community Plan is here with us, and she'll explain how you can enter to win grand prizes. Thank you and welcome.
Thank you. My name is Lori. I'm the maternity care manager with United Healthcare, and I appreciate you having me here today, and I look forward to learning more about this topic. We are really excited to announce the raffle prizes for this virtual series and how you can enter to win a new crib, a car seat combo, a baby monitor, and an Amazon gift card. How to enter? Every day, watch the live session to get the link and enter our for our entry into our grand prizes. We'll share the link in the comments below of each session. Viewers will have until Sunday, May 16th to enter to win, and winners will be notified and sent their gifts by Monday, May 17th. As a sponsor of Thundermist, thank you for joining, and if you're a United Healthcare member, please don't hesitate to contact me for any questions or needed support. And if you have any questions for us, please leave them in the comments below. Thank you and enjoy the event.
Great. Now let's get started. So we're going to start with Dr. Buckley. We have a series of hard-hitting questions regarding the COVID-19 vaccine and fertility. And so our first question is, does the vaccine affect fertility? And should I get the vaccine now before I become pregnant?
Oh, this is such a good question. I'm so glad we started off with this one. There actually has been a lot of research around this. And according to the biggest leading voices in pregnancy-related care, so the Society of Maternal Fetal Medicine and the American College of Obstetricians and Gynecologists, right now there is no evidence that the vaccine affects fertility. And that's really important for everyone to know, because I know that was a really big concern when the vaccine first started. There's a lot of researchers who have been monitoring the people who originally signed up for the clinical trials when Pfizer and Moderna were first doing that last part of their clinical trial before the vaccine was able to be released to the public. And so fertility wasn't specifically studied when they were giving the vaccine, but they did track all of these participants, and there has been no confirmed loss of fertility among the participants or among the millions of people who have received the vaccine since the authorization. These vaccines were also given to animals before they were being given to humans. That's also a part of clinical trials as things are being tried to be available to the public. And those animal studies also did not show any signs or loss of fertility. So that means that loss of fertility is really scientifically unlikely, which is great. I'm really glad that I can say that. So my recommendation would be for you to get the vaccine as soon as it's available to you, regardless of whether you're attempting pregnancy or are currently pregnant, to keep yourself safe from COVID.
Awesome. Our next question is for Dr. Panjwani. Is there any reason not to have a baby right now during a pandemic?
Oh, that's such a great question as well. And so, I mean, having a baby is so scary and so exciting, pandemic or not. That being said, a pandemic does have its own sets of challenges, opportunities, and lots of changes that happen with people in their lives during a pandemic. And so a lot of this is really your personal comfort level, what's been going on and how it's affected you and your personal support system. And it's really important in this pandemic to think about the health and the potential risks of COVID. The studies that we have, the current reports suggest that pregnant people do have a higher risk for more severe illness and death from COVID than non-pregnant people. And some pregnant people with pre-existing or conditions that develop in pregnancy, like gestational diabetes, may have a higher risk of severe illness from COVID. So I'd like to echo Dr. Buckley in her statement and my recommendation for patients to get the COVID vaccine if you are thinking about getting pregnant. And there's also some reports that COVID may pass from a pregnant person to their baby during the pregnancy, but this seems to be exceptionally rare. And that being said, the COVID vaccine does offer some protection for baby as well. The antibodies are able to be passed on to the babies. But whatever you do decide and whenever you decide to have a baby, Thundermist is here to help provide safe prenatal care for you. About your medical history and your concerns regarding COVID and how that's going to affect you before trying to get pregnant, or if you want to wait. We're always here to support you and answer any more questions that you have.
Great. Next question is for you, Dr. Buckley. So what should you know or do before becoming pregnant?
Sure. So if I were to just like really focus in on one thing to really think about what to know or what to do, it would be to try to be the healthiest version of yourself, whatever that looks like right now in our current pandemic state and in the craziness of life. So just really try to be your healthiest version of yourself. So the word healthy has a lot of different meanings for a lot of folks, and just some ideas about what the word healthy to me means. Like it means trying to intentionally move your body every day, whether that's going for a walk or going for a hike or parking farther away at the grocery store or from your place of employment so you get some extra steps in, or chasing your kiddos around the park or the track or wherever you might be going, doing some yoga from a YouTube video inside your house, whatever that is, whatever makes your body feel good. Intentionally try to move it every day. Other ways that I think about health is I think about what your nutrition looks like, and thinking about lots of fruits and veggies and whole grains like brown rice and brown pasta, and lean proteins like chicken and turkey and beans and lentils and all of those like really good healthy things that you're putting into your body. Trying to put those things into your body as much as you can. Other things, drinking lots of water. Water is so important for our bodies, whether we're pregnant or not. But if you are planning to become pregnant or you are pregnant, your body needs that much more water. So trying to target like 2 or 3 liters of water a day is totally fine if it's the stuff that comes from the faucet. Especially if you live in Warwick, because it's got a little fluoride in it, which is good for your teeth. And then, one other like really big piece of being healthy is your own mental health, and being able to give yourself a little bit of time just to do what you need to do every day, even if it's just 5 minutes to focus on your own goals, or to calm your mind and to like shut it off just for 5 minutes, to not worry about anything for that small period of time, just to make sure you're really caring for yourself while you're caring for all of the other things around you. The other thing that I would suggest if you're considering to become pregnant would be to check in with your provider about it, because there might be some things like in your own medical history that you might want to talk about a little bit before. If you recently found out that you're pregnant and you hadn't been able to check in with your provider yet, getting in with them as soon as possible, just to make sure that all the I's are dotted and the T's are crossed. And then the last thing is that most people will probably take a prenatal vitamin. So if you haven't had a chance to see your provider and you're thinking about becoming pregnant, optimally you start your prenatal vitamin about 3 months before your pregnancy starts. So feel free to go to any pharmacy, get one over the counter, and it'll make sure that you're getting all of those good vitamins and nutrients that your body needs to support a really healthy pregnancy.
Thank you for that, Dr. Buckley. So, Dr. Panjwani, when should a person become concerned that they may not be able to conceive without help?
Yeah. So in terms of getting pregnant and in terms of like fertility, there's a whole lot of factors that can affect your fertility. Some are things that you can control and some things that you can't control. One of the things that you can't control is like your age. We do know that fertility can decline a little bit with age, so something to keep in mind when you are trying to get pregnant. Like it might not happen as quickly as it might have when you were a little bit younger. Some other things that you can control and that can affect your fertility. There's things such as weight. So, being severely overweight or being severely underweight, that can affect your ovulation sometimes. And so that can in turn affect your fertility. So something that you can always reach out to your provider about. That's something that you're concerned about. Other things that can affect your fertility and can affect that you getting pregnant are sexually transmitted infections. So like chlamydia, gonorrhea, things like that. If you are carrying one of those, that can affect your fertility as well. So if that's something you're concerned about, we'll definitely get that checked out. Other things that we can control are smoking and alcohol use. So, smoking, even passive smoking. So if somebody around you is smoking and you're inhaling in that secondhand smoke, can affect your chance of conceiving if you have a uterus, and can also reduce semen quality as well. And then also in terms of alcohol, can also affect your fertility as well. And both smoking and alcohol, the more you limit those in pregnancy, the healthier your pregnancy will be. So, to keep in mind for conceiving as well as the pregnancy. And then stress. I know that that's really hard, especially with the pandemic going on, but things like stress can affect your relationship with your partner and can affect your body. And in severe cases can affect your ovulation and sperm production, like some of the other things that we've talked about. So kind of a mixed picture of things that can affect and some things that you can work on if that's something that you feel like is affecting your ability to conceive. And then for the folks that are trying to conceive with a sperm and an egg, one of the things that can be helpful is tracking your ovulation. And so ovulation is where the egg comes out of your ovary and goes into your fallopian tube and kind of into your the month when you're the most fertile. And so this is usually around 12 to 16 days before your period starts. And so some folks will plan on having the sperm meet the egg kind of around that time to maximize your chances of fertilization. And there's a variety of like period and ovulation tracker phone apps that you can get because it's hard to remember all these things sometimes. So the phone apps can be really helpful to predict when those days will be happening, if the ovulation days will be happening. If you don't have regular periods or you want to talk about like more specific concerns in regards to fertility and family planning, would definitely make an appointment with your OB provider. You can always talk about pregnancy with your OB provider before you get pregnant if there's anything else that you notice that's going on that I haven't mentioned on this list that you want to discuss.
Awesome. Thank you for that answer, Dr. Panjwani. Dr. Buckley.
Can I just add one more thing to that?
Of course you can.
And so thank Shamila, that was like super thorough. And the only other thing I would add is that try not to get worried if you aren't pregnant after the first couple of times that you try or after the first couple of cycles that you try. All of that can be really normal. And at the end of the day, it can actually, the amount of time that a body can become pregnant is it's a very limited period of time over the course of a month. And so a lot of this is timing. It doesn't mean that you're not healthy. It doesn't mean that the sperm or your partner isn't healthy. It just means that that your body just might need more time, or maybe the timing is off a little bit. So I know it can be a really exciting time. It can sometimes be stressful. But the biggest piece of advice I would say would be try not to get too stressed out by it if it doesn't happen immediately, because more than likely it'll probably happen in the future.
Awesome. Thank you for that addition, Dr. Buckley. We do have a question for you, Dr. Buckley. We know that Thundermist recognizes families are made in a variety of ways. And can you expand on different ways you can help people achieve the goals of expanding their families?
Sure. So there's so many kinds of families, and there's so many ways to make your family. And our goal at Thundermist is to support our patients creating families in whatever way feels best to you. And so we've talked a lot about a biological pregnancy so far, but we haven't actually mentioned yet that you can also become a parent by adoption, and that is really awesome. And so if you're considering potentially looking into adoption, definitely chat with your provider, and they can connect you with the local agencies where you can explore that process and get started on that process if that's the direction that you want to go. If we go back to the biological pregnancy, though, I think it probably makes sense to do a quick breakdown of how a pregnancy occurs. So like Dr. Panjwani mentioned earlier, we've got an egg from an ovary and a sperm from a testicle. And in order for a pregnancy to happen, the egg and the sperm have to combine together. And eventually, if the egg and the sperm combining together is successful, then that forms an embryo. And then the embryo can eventually develop into a fetus or a baby. And so knowing that, we can explore ways that the combination of the egg and the sperm can happen. Of course, we all know like the common way that it happens. So I want to focus on the other ways that it can happen. There's something called, or a procedure called IUI. So IUI stands for intrauterine insemination. And so basically this is when a person with a uterus and ovaries gets donor sperm, and their provider puts the sperm into the uterus when they're ovulating. And so, basically that gives the opportunity for the sperm and the egg to meet and then develop the embryo and then develop the fetus or the baby. It doesn't happen, it's not like a guaranteed, it happens every time, but that's the way to make that combination happen. There's also another option called IVF, which is also called in vitro fertilization. And so this is actually when the eggs are removed from a person's ovaries, and then sperm is removed from someone's testicles, and then the sperm and the egg combine outside of the human body. And then the providers who made that process happen are watching the egg and the sperm grow. And so if it grows enough, then the provider will actually put that embryo back into a uterus. The uterus could be the egg's original uterus, or it could be someone else's uterus who's agreed to carry the pregnancy. And the common term for that is a gestational carrier or a surrogate. Slightly different terms, but those are the two other uteruses that could carry it. And so this is a really basic breakdown of these options. And of course, there can be a lot more complexity to it. So if you're thinking about any of these options, you should definitely connect with your provider to explore it a little bit more. And specifically in Rhode Island, we have a really great reproductive endocrinology and infertility clinic in Providence. And more than likely, if these were options that you wanted, your provider would reference you there.
Awesome. Thank you for that answer, Dr. Buckley. Dr. Panjwani, do you mind just speaking to options a person may have if they don't have insurance?
Absolutely. So here in Rhode Island, our pregnant patients can be eligible for healthcare coverage through Rhode Island Medicaid or an insurance plan through HealthSource RI. And Thundermist has a great, wonderful team of licensed social workers that can help assist you with a lot of these applications for different. There's Right Care. So that's Rhode Island's Medicaid program for families with children, for pregnant women, and for children under 19. So families that want to participate in those have a choice of 3. So you can go to Neighborhood Health Plan of Rhode Island, Tufts Health Plan, or United Healthcare Community Plan. So you heard from Lori today, so she is part of that as well. And there's also Right Share, which can help pay for an employer's health insurance plan. And the state will help pay for some of the costs or all of the costs of the employer's healthcare coverage. And so there's different eligibility criteria for that. But if you're pregnant, that's a wonderful option for you that you're able to do. And our social workers can definitely help you with the application process for that. Some of the things that are covered under the Medicaid plan are doctor's office visits, immunizations. You can get your prescriptions, your lab tests. Mental health services and drug and alcohol treatment are also covered under this as well. Any hospital care, any emergency care, any home care that you would need, nutrition services, interpreter services, parenting classes, dental care. So this kind of goes on and on. It's a wonderful option for people that are really seeking health insurance. And additionally, there's also WIC benefits that you can apply for. So WIC is for women, infants, and children, not children's. The Rhode Islanders that are pregnant, breastfeeding, or postpartum up to 6 months, regardless of the birth outcome, or have a child up to the age of 5 can participate in this program. So the WIC benefits can really help provide you and your child with one-on-one nutrition counseling, referrals with any services you need, and a food prescription to meet your needs and your child's specific needs. And they have great resources for healthy choices in lifestyle, any services that you would need, and they provide a lot of support with breastfeeding and how to screen for health, growth, and development as well. And just to let you guys know, all WIC sites are open and providing remote services as well.
Thank you for that information. Dr. Buckley, how can Thundermist support patients with a substance use disorder in pregnancy?
Yeah, that's a great question. So the most important thing to know, if you have a substance use disorder and you're pregnant or you're thinking of becoming pregnant, is that we, as your Thundermist providers, are here to help you and to advocate for you. We don't want you to avoid getting prenatal care because you may be using substances or you have a history of using substances, because our goal is to help you create the healthiest environment for your pregnancy. And part of that is getting regular prenatal care. And so specifically for pregnant people who are on buprenorphine, or we also call it Suboxone, or we also call it Subutex, or for pregnant people who want to be on this medication because of some concerns with using opiates or pills or anything kind of in that category, we are both able to start and continue this medicine at Thundermist and also follow you throughout your pregnancy and also deliver your baby. So know that this is something that we want to help you with. If you're not specifically on buprenorphine, Suboxone, or Subutex, if you're on methadone, or if you have another substance use concern that there might not be a medicine for it, we are here for all of those things as well. And so our providers will counsel you individually in regards to the pregnancy and the baby considerations when you're using buprenorphine or Suboxone or Subutex or methadone or any of the other substances that you may or may not have used. And then also connect you with our behavioral health providers to further support your journey and your pathway to recovery. And so we're here for you. We want to help you, and we want to really help you create the healthiest environment possible.
Awesome. Thank you for that. Let's see if we have any questions from our viewers. So if you have any questions, please feel free to put them in the chat, and we will be able to answer them. I don't see any questions now, so we'll give it another moment. Dr. Buckley, we do have a question here. Is it possible for you to speak a little bit more about what to expect from the IVF process?
Sure. So if you are someone who is considering IVF for either yourself or if your partner is considering IVF, I think it's important to know that the process of making that happen can be a little bit more complex, just given that just by the way that the egg and the sperm has to be combined together. I think that the first thing to expect, if you're using your own body's eggs, there probably will be a series of injections that you might need to give yourself. The provider, so here in Rhode Island, it would probably be one of the physicians at REI, the Reproductive Endocrinology and Infertility Facility. They would be the ones to then talk to you about how they would be able to get the eggs from inside your body to outside the body. And then they'd also be the ones to talk to you about the process of the egg and the sperm combining and how to find the sperm if you don't have someone that you've already identified as going to be the sperm donor, and then the process of, how long the egg and the sperm need to grow outside before it can go back inside. So it can be a fairly complex discussion. So I would say my biggest piece of advice would be if you felt like you were on the pathway to do IVF, make sure you get in with that specialist and have a good conversation about the timing of everything, because it does tend to be a little bit more complex and a little bit more time intensive.
Awesome. Do we have any more questions from the audience at all? So in the absence of any additional questions, I just want to thank everyone. We hope everyone enjoyed getting to know our providers, our sponsors, and you were able to get your questions answered. Before you leave today's session, be sure to enter to win our grand prize raffles. Participants can look in the comments section for a link to enter. You can also look on our Facebook page, because our session was recorded and will be available for viewing in the future. We'd like to thank you, Neighborhood Health Plan of Rhode Island, United Healthcare Community Plan of Rhode Island, Tufts Health Plan, and Landmark Medical Center for generously sponsoring this virtual series. If you need prenatal care, Thundermist offers services for all ages and does not turn anyone away due to the inability to pay. Call 401-767-4100 to schedule an appointment today. Thank you, everyone. Have a great day.